My name is Amelia Marino, and I am one of the dietitians at the hospital. If I have your permission, I'm going to be performing a nutrition-focused physical exam. This is a quick assessment where I'm going to be looking for both physical and visual signs of nutrition-related problems. This will help me to identify any nutrition deficiencies that you might have. Would you be comfortable with this?
Yes.
Before beginning the physical examination, I will put on my gloves. In addition, before beginning the physical examination, I will start with a general survey. This will help me to better understand the patient's state of health, both physically and neurologically. What is your name and where are we right now?
My name is Pat, and we're in the hospital.
Any indications of mental confusion or hyperirritability may indicate that there is a protein deficiency that is affecting the patient's neurological status. Have you lost any weight in the past 3 months?
No.
How has your appetite been?
Pretty good.
Asking these questions will help me to better understand the patient's state of health and learn more about the patient's appetite. I will begin the physical examination by inspecting the patient's skin for any abnormalities. I will look at the skin color, integrity, turgor, and the temperature of the skin. If my examination reveals any delayed wound healing, this could indicate that the patient has a protein deficiency. If I see an abnormal dryness, known as xerosis, or any signs of dermatitis, the patient might be suffering from an essential fatty acid deficiency as well. To examine the patient's upper extremities, I will ask the patient to extend one of their hands. I will look at the nails, nail bed, and perfusion for any discoloration or irregular shape. I will gently press down on the nail beds to check for their blood flow. Color should return within a couple of seconds to indicate a good blood flow. If I find that the patient's nails are dull or lackluster, this could indicate that there's a protein deficiency at hand. Similarly, nails that are ridging or transverse could signal that the patient is deficient in protein as well. After assessing the patient's nails, I will move up to the head to examine the hair. I will use my fingers to gently palpate the hair to see if it is dull or dry. If I find that the patient's hair is dull or dry, this could indicate that there is a protein or essential fatty acid deficiency. A thinness to the hair or depigmentation could also indicate a protein deficiency. After examining the patient's hair, I will examine the patient's face to look for any signs of asymmetry or an irregular shape. If the patient has a moon face or a rounding of the face, this could indicate that there is a protein or energy deficiency. If the patient has a loss of color in the face, or if there is any scaling of the skin around the nostrils, this could also indicate a protein deficiency. I will continue my examination of the face by gently palpating the temporals to look for any depression or scoping. Any temporal wasting may also indicate that the patient is deficient of protein or energy. To assess the orbital region of the face, I will gently touch the orbital fat pads to see if there has been any fat loss. This could indicate malnutrition. To evaluate the patient's eyes, I will hold up a finger and ask the patient to follow it with his eyes. After examining the patient's eyes, I will have the patient open his mouth to assess the oral cavity. I will look inside the oral cavity before instructing the patient to stick out his tongue for examination. I will ask the patient to smile big so I can examine his teeth before gently pulling down the bottom lip to examine the patient's gums. After examining the mouth, I will gently palpate the nerves around the mandible for any signs of dysphagia. If my examination reveals that the parotid gland is enlarged, this could also hint towards a protein deficiency. I will begin my assessment of the upper body by visually looking for any muscle or fat loss. If the patient has a wasted appearance, this could indicate that he has a protein energy deficiency. I will look at the shoulder to see if the chromium process is protruding before looking for any muscle loss around the clavicle as well. Next, I will instruct the patient to make an OK sign with their hands. I will gently palpate within the patient's fingers to see if there's any fat loss in this area before guiding the patient's arm into a 90-degree angle so I can evaluate the upper arm region. With the patient's arm in this position, I will gently palpate the tricep area for any fat loss. To evaluate the back region, I will have the patient stand up and place both hands on a wall if this is possible. I will assess the patient's scapular, latissimus dorsi, iliac crest, and rib crest, looking for any signs of any protruding bones. To examine the patient's lower body, I will have the patient sit and slightly extend his right leg. With his right leg extended, I will palpate the quad muscles gently to look for any signs of muscle loss. Before the patient returns their leg to the ground, I will gently palpate the patella to assess its prominence. With the patient's leg on the floor, I will palpate the gastrocnemius muscle to look for any signs of muscle thinness. I will also look for any edema in the leg by gently pressing on the top of the patient's foot and ankle. Skin that is low in edema should return to its original position within a couple of seconds. Edema may also indicate that the patient has a protein deficiency. With the patient lying down, I will examine the abdomen. The 4 examination techniques used for the abdomen are inspection, palpation, auscultation, and percussion. I will begin by inspecting the abdomen for asymmetry, rashes, lesions, surgical sites, and fluid buildup. Next, I will palpate the abdomen by lightly pressing on the skin. I will use this technique to identify any edema, distension, ascites, skin turgor, and other conditions. I will continue my examination of the abdomen with percussion. This is a technique that is used to identify gastric air bubbles or intestinal air. I will begin by placing the middle finger of my non-dominant hand over the area to be percussed. To perform this technique, I will take the fingers of my dominant hand and gently tap on my middle finger. This should produce a sound that will help me determine what is happening in the viscera underneath. I will conclude my examination with auscultation, using a stethoscope to listen to the sounds produced by various body parts. If I discover that the liver is enlarged during my inspection of the abdomen, this could indicate that the patient has a protein deficiency.